Aspirin, also known as acetylsalicylic acid, is a commonly used medication with various effects on the body. Here are some of the primary effects of aspirin. Analgesic pain relief. Aspirin is known for its analgesic properties, meaning it can help alleviate pain. It works by inhibiting the production of certain chemicals, called prostaglandins, that are involved in the process of inflammation and pain signaling. Anti-inflammatory. Aspirin has anti-inflammatory effects, which means it can reduce swelling, redness, and heat associated with inflammation. By inhibiting the production of prostaglandins, aspirin helps mitigate the body's inflammatory response. Antipyretic. Fever reduction. Aspirin can also help reduce fever by acting on the hypothalamus, which regulates body temperature. It lowers elevated body temperature by inhibiting the production of prostaglandins in the brain. Antiplatelet. Blood thinning. Aspirin has the ability to inhibit the aggregation of platelets, which are involved in blood clotting. By reducing platelet activity, aspirin can help prevent the formation of blood clots and reduce the risk of conditions like heart attacks and strokes. Cardiovascular effects. Due to its antiplatelet properties, aspirin is often used as a preventive measure against cardiovascular diseases. It can help prevent the formation of blood clots that can block arteries and lead to heart attacks or strokes. Cancer prevention. Limited evidence. Some studies have suggested that long-term, low-dose aspirin use may reduce the risk of certain types of cancer, particularly colorectal cancer. However, more research is needed to establish a definitive link. It's important to note that aspirin, like any medication, can have side effects and interactions with other drugs. Common side effects of aspirin include stomach upset, heartburn, and increased risk of bleeding. Aspirin should be used under the guidance of a healthcare professional and according to the recommended dosage to minimize the risk of adverse effects.